For a while now, Australians have been warned about eating too much processed red meat because of links to diseases like bowel cancer. Now, a new US study has found there could be a lot more than that to worry about. It's also found that boosting your health could be as simple as swapping one serve of red meat for fish or chicken. Medical reporter Sophie Scott filed this report.
It's known that processed red meat, such as sausages and bacon, can increase your chance of health problems. Now, new research from the Harvard School of Public Health says eating too much of any kind of red meat could be risky.
The study found that there was an increased mortality rate associated with cardiovascular disease and cancer, some cancers, with just an increase of one serving of red or unprocessed meats per day.
It was a significant and long-term study, researchers tracking more than 120,000 people for 20 years. They found high consumption of any kind of red meat increased the risk of dying from heart disease and cancer by 21%.
Both processed and unprocessed red meat had higher risk of premature deaths, but the processed meat was definitely somewhat higher.
Not all experts agree with the findings, saying red meat is an important source of iron, zinc and vitamin D.
The meat in Australia tends to be leaner. Butchers do a lot of trimming, and we also have leaner breeds of animals. So there's less fat and less marbling between the meat fibres.
Australian food guidelines recommend people consume 3 to 4 serves a week of red meat and limit or avoid processed foods.
The fat in red meat certainly promotes a rise in cholesterol, and that will give you more heart disease. And why you get cancer from red meat protein as opposed to poultry protein or fish protein is really totally unknown.
Researchers say reducing the risk of premature death because of your diet is as easy as swapping one serve of red meat a day for fish or poultry. Sophie Scott, ABC News.